Thank you so much, Mike. Good afternoon and welcome everyone. Very pleased and honored to be here on the webinar today to talk about our involvement in this initiative about basically applying the principles of value-based insurance design to the exchange marketplace. This has been an 18-month-long effort that has involved multiple stakeholders, including plans, state and federal officials, and leading experts from the field, including academic, actuarial, as well as clinical. And special thanks really go to Mark Fendrick and Michael Chernew for both hosting this webinar and really helping to spearhead this important initiative. AHIP has been a strong supporter of this concept for many years, and VBID principles have been successfully adopted in other market segments, including among large self-insured employers, among state employee programs, including in Connecticut and Oregon, and in the Medicare Advantage program, which has been now, this model has been expanded to all 50 states, and tens of thousands of Medicare Advantage beneficiaries are benefiting from lower copays or additional enhanced benefits due to their chronic conditions. The concept of eliminating and greatly reducing cost sharing for high-value services, especially treatments and drugs to treat chronic conditions, holds tremendous promise in reducing financial barriers to needed care, improving adherence to prescribed treatments, and achieving better health outcomes. For this group, designing a VBID plan for the exchange marketplace is complicated by the fact that plans need to meet specific actuarial value targets. That means reduced cost sharing for high value services need to be offset by increasing cost sharing for low value services such as expensive imaging or non-preferred brand name drugs when a generic equivalent is available. And given that this is a price sensitive market, the exchange market, designing a VBID plan for the exchange marketplace should be done on a cost neutral basis. That is, no increase in premiums as compared to a standard base plan. So with that in mind, this group came up with the solution, which is VBID-X, a prototypical benefit design for the exchange market that eliminates or reduces cost sharing for high value services without increasing premiums or deductibles. This is really a template of how VBID can be implemented, but it importantly is not a one size fits all. As far as AHIP's role in this initiative, we were very focused on, from a plan perspective, on what is feasible and realistic. This is from both an actuarial and pricing perspective, from a cost and budgetary perspective, from a risk pool stability perspective, as well as kind of from a pure operational or benefit administration perspective. A couple of principles that we brought to our engagement was, number one, really focusing on increasing cost sharing for targeted service categories that are more likely to be overused as opposed to increases in general cost sharing and deductibles. As everyone here is well aware, there's been a trend of increasing deductibles in the employer market, and deductibles in the exchange market, at least for those who don't qualify for cost sharing assistance, are high. And this has been shown to reduce both high and low value care, and a particular risk for those with multiple chronic conditions who would forego needed medical care because of cost. So being mindful of deductibles and implementing VBID in a way so that deductibles don't increase was an important priority. Second is kind of being mindful of operational and administrative barriers to implementation, and looking at this from a pragmatic perspective, as Michael mentioned at the outset, not letting the perfect be the enemy of the good. And then finally, building in flexibility in both plan design and management to assure that it can be successfully implemented. This pertains to both the specific services that are targeted for the VBID intervention, as well as the ability for plans to manage costs of the enhanced benefit, kind of consistent with current best practice standards and clinical guidelines. So to sum up, we believe this is initiative, and VBID-X is a very important way to improve the quality and value of insurance coverage, especially for millions of Americans with chronic conditions. And while this culminates an extraordinary effort, in producing this paper. It's really the beginning of the process, and the challenge now is kind of take the findings and insights from this important report and work towards implementation. And so looking forward to engaging in dialogue with my colleagues here and those on the webinar about the best way to move forward. And so with that, I'm going to turn it over to my colleague Lourdes for her remarks.